Below is a fully expanded, highly detailed, textbook-level monograph for cyclophosphamide, covering all requested sections with depth appropriate for medical, pharmacy, and nursing education, still written for information only, not medical advice. Detailed drug monograph. 1. Generic name, drug class, brand names, drug forms. Generic name, cyclophosphamide. Drug class, alkylating agent, nitrogen mustard derivative, antineoplastic agent, immunosuppressant. Common brand names, Cytoxan, Procytox, others vary by region. Available drug forms, oral tablets, commonly 25 milligrams, 50 milligrams, powder for injection IV, vials, 100 milligrams, 500 milligrams, 1G, 2G, reconstituted IV solution prepared by healthcare professionals. Number 2. Definition: cyclophosphamide is a prodrug alkylating agent used in chemotherapy and immunosuppressive therapy. After activation in the liver, it interferes with DNA replication and transcription, causing cell death, especially in rapidly dividing cells such as cancer cells and immune cells. Number 3. Mechanism of action. Cyclophosphamide itself is inactive until metabolized by hepatic cytochrome P450 enzymes into active metabolites. 1. Phosphoramide mustard. The primary cytotoxic compound forms cross-links between DNA strands, prevents DNA replication, apoptosis. Cell cycle nonspecific, acts in all phases. 2. Acrolein, not cytotoxic to cancer cells, causes hemorrhagic cystitis by irritating bladder epithelium. Mechanistic summary: alkylation of guanine bases, DNA strand breakage, impaired RNA and protein synthesis, potent suppression of B and T cells, immunosuppressive effects. Number 4. Pharmacokinetics. Absorption. Excellent oral bioavailability, 75 to 90%. Food may delay absorption but not overall exposure. Distribution. Widely distributed into tissues, including tumor sites, crosses placenta and enters breast milk. Volume of distribution increases with body weight. Metabolism. Extensive hepatic metabolism via CYPB6, CYP3A4, CYPC9, CYP2C19, converted to active metabolites, phosphoramide mustard, toxic byproduct, acrolein. Elimination. Renal excretion, 60 to 70% as metabolites, minor biliary excretion. Half-life. Cyclophosphamide, 3 to 12 hours, metabolites, hours, days, depending on renal function. Special populations: renal impairment, reduced clearance, increased toxicity. Hepatic impairment, decreased activation, and altered efficacy. Number 5. Uses cyclophosphamide is used in oncology, lymphomas, Hodgkin and non-Hodgkin, leukemias, AML, CLL, multiple myeloma, breast cancer, including CMF regimen, ovarian cancer, lung cancer, part of some regimens, sarcomas, neuroblastoma, retinoblastoma. Autoimmune and non-cancer conditions: severe systemic lupus erythematosus, especially lupus nephritis, granulomatosis with polyangiitis, Wegener's, microscopic polyangiitis, severe rheumatoid arthritis, refractory, nephrotic syndrome, steroid-resistant, multiple sclerosis, rare, severe cases, autoimmune hemolytic anemia. Number 6. Indications, detailed. FDA common clinical indications: malignant lymphomas, multiple myeloma, leukemias, breast carcinoma, ovarian carcinoma. Off-label but established evidence: ANCA-associated vasculitis induction therapy, lupus nephritis induction therapy, NIH regimen, Eurolupus regimen, severe dermatomyositis polymyositis, organ transplant conditioning regimens, bone marrow transplant conditioning. Number 7. Contraindications. Absolute contraindications: hypersensitivity to cyclophosphamide, active severe infection, severe bone marrow suppression, urinary obstruction, severe renal or hepatic impairment, relative but often avoided, pregnancy, teratogenic unless no safer alternative. Relative contraindications: pre-existing bladder disease, prior pelvic radiation, bladder toxicity, previous cumulative alkylating agent exposure, heart failure or cardiomyopathy. Number 8. Precautions before taking this medicine. Medical conditions to disclose: kidney or liver disease, heart disease or prior anthracycline use, active or chronic infections, low blood counts, prior radiation or chemotherapy, bladder disorders or hematuria, fertility concerns, causes ovarian and testicular toxicity, monitoring needed before therapy, CBC with differential, renal function tests, liver panel, urinalysis monitor for hematuria, pregnancy test, women of reproductive age. Key precautions: hydration is essential, 2-3 liters per day recommended. Frequent voiding reduces bladder time exposure. Mesna is often co-administered to prevent hemorrhagic cystitis, avoid live vaccines, use effective contraception, male and female, potential infertility, discuss sperm egg preservation. Number 9, how to use. Oral use, swallow tablets whole. Do not crush. Take early in the morning, reduces bladder exposure. Take with or without food. IV use, administered by infusion in hospital clinic, usually part of a multi-agent chemotherapy regimen, pre-hydration and post-hydration often required. General use instructions. Maintain hydration before and after dose. Follow exact schedule based on treatment cycle. Report any signs of infection immediately. Number 10. Dosing information. General. Exact dosing varies by protocol. These are typical ranges. Already A. Oncology dofomas, CHOP regimen, cyclophosphamide, 750 mg per mIV on day 1, every 21 days. BIACOP regimen, 650 mg IV on day 1. Breast cancer, CMF regimen, cyclophosphamide 100 mg misocreted orally on days 1 to 14 of a 28-day cycle, or 600 mg per methylglycerin IV day 1 every 21 days. Multiple myeloma, 500 to 1,000 mg per IV every 2 to 4 weeks. B. Autoimmune diseases. Lupus nephritis, NIH protocol 0.5 to 1 gram per credit anthi minus 6 months. Euro lupus protocol 500 mg every 2 weeks, 3 months. ANCA-associated vasculitis 2 mg per kilogram a day orally or 15 mg per kilogram IV at weeks 0 to 4, then every 3 to 4 weeks. Dosing adjustments required for renal impairment, age 60, or cytopenias. Number 11. Misdose and overdose. Misdose, oral, take as soon as remembered if same day, skip if next dose is near, never double dose. Misdose IV, contact treating clinic to reschedule, do not attempt to self-compensate. Shashed overdose symptoms, severe bone marrow suppression, hemorrhagic cystitis, cardiotoxicity, severe nausea, vomiting, infection, fever, hyponatremia, seizures, SIAD8. Seek emergency medical care immediately. Number 12, stop or avoid taking cyclophosphamide if developed blood in urine, fever, 38 degrees Fahrenheit, unexplained bruising or bleeding, severe diarrhea or vomiting causing dehydration, jaundice, signs of heart failure, shortness of breath, swelling, severe fatigue or pallor indicating anemia. Do not stop therapy unless instructed. Number 13, side effects detailed. Common side effects, nausea, vomiting, loss of appetite, fatigue, hair loss, alopecia, bone marrow suppression, neutropenia, thrombocytopenia, anemia, menstrual changes, amenorrhea, testicular atrophy. Serious side effects, 1 hemorrhagic cystitis, signature toxicity, caused by acrolein. Symptoms, painful urination, hematuria, prevention, hydration, mesna. 2, cardiotoxicity, high dose associated with myocarditis, heart failure, arrhythmias. Secondary malignancies, risk increases with cumulative dose, includes bladder cancer, leukemia. 4, pulmonary toxicity, pneumonitis, pulmonary fibrosis. Infertility, ovarian failure, testicular failure, usually dose-dependent and may be irreversible. Number 6, hepatotoxicity, elevated liver enzymes, rare veno-occlusive disease. 7, hyponatremia, water retention, confusion, seizures, severe cases. Number 14, vital information. Hydration is crucial to prevent bladder toxicity. Frequent monitoring, CBC, kidney and liver function, electrolytes, risk of infections is high due to immunosuppression. Do not receive live vaccines. Use reliable contraception during and after therapy. Long-term risk of secondary cancer. May require mesna with high doses. Number 15, drug interactions. CYP interactions. CYP inducers drug effect, rifampin, phenytoin, carbamazepine, CYP inhibitors, toxicity, azole antifungals, chloramphenicol, macrolides. Other significant interactions, anthracyclines, e.g. doxorubicin, additive cardiotoxicity, allopurinol, bone marrow suppression, warfarin, altered INR, other immunosuppressants, infection risk, radiation, enhanced bladder toxicity, thiazide diuretics, increased leukopenia. Thank you. Have a nice day.